The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon. My name is Rachel Chung. I am the Disabilities Coordinator for the Archdiocese of Washington, Department of Special Needs Ministries.
And good afternoon. I'm Mary O'Mara, the Executive Director for the Department of Special Needs Ministries here in the Archdiocese.
So we welcome all our attendees today for our first in a series of webinars that we will hold on the second Thursday of the month from 12 to 1. So we are so looking forward to this beginning topic for our series, Aging Impacts for Persons Living with Intellectual and Developmental Disabilities. So welcome, everyone. Before coming to the Archdiocese, I worked as a resource coordinator in Baltimore and later transferred to Gaithersburg. I also worked as an assistant director with the Montgomery County Vocational and Day Services. In my roles as a resource coordinator and staff person at the Montgomery County, I met many families and encountered many different situations. Since the Montgomery County has been in operation for over 60 years, there were several people who were served by the ARC for 20, 30, and even more than 40 years. As the people we supported aged, their needs changed. Think about yourself. Are you the same person you were 20 years ago? It has become apparent over the last few decades, as people we support live longer, service providers and families needed to reflect and plan for an aging person with developmental disabilities, even including end-of-life planning. Today's presentation is designed to start a conversation, not to bring it to completion, to start a discussion that is not always easy to start. As I mentioned before, I have met people with intellectual and developmental disabilities who were 60, 70, and even a few in their 80s. This is now more the normal than the unusual. During today's webinar, we will look at the specific ways aging impacts people living with intellectual disabilities. But first, let us look how we are all aging. According to U.S. Census data, in 2010, 13% of the population was over the age of 65. By the year 2050, it is projected to be 20.9% of the population. So we can see in this short period of time, the entire country will be facing many people who are over the age of 65. According to the U.S. Census Bureau, the estimated percent of the population 65 and older is 4.9% for Maryland, and for Washington, D.C., it is 12.1%. So again, it is a pretty big portion of the population who is 65 and older. And as we all know, and we may not want to say, but aging, although people are living longer and healthier, it does increase our healthcare needs. According to the July 2017 issue of Health Affairs, only 1/3 of adults in the United States have completed end-of-life care planning. So we can see from these trends, again, the population here in the United States is aging, and also we have not done well in planning for our own end-of-life care needs. So again, the people we support with intellectual and developmental disabilities are aging too. According to the Centers for Disease Control, in 1983, the average lifespan of a person living with Down syndrome was 10 years old. In 2007, it increased to 47 years old. And according to the National Association of Down Syndrome, The current life expectancy is 60 years old. So again, we see in a short period of time how much the life expectancy for a specific intellectual and developmental disability, such as Down syndrome, increased from 10 years old to 60 years old. And as we mentioned, people with developmental disabilities will face the same age health-related healthcare needs that probably most of us will face, which is high blood pressure, diabetes, joint pain, cancer, etc. But at the same time, people with intellectual and developmental disabilities will also face unique aging concerns, like there is a strong link, for example, there is a strong link between Down syndrome and dementia-related illnesses. So there's a very high likelihood, almost 100%, that a person with Down syndrome will develop a dementia-related illness such as Alzheimer's. So, what are the specific impacts of aging and people living with intellectual and developmental disabilities? It is estimated that approximately 10% of adults living with intellectual and developmental disabilities are receiving government service. So the vast majority of people with intellectual and developmental disabilities are living at home and not in a service delivery system. In some cases, the person is living with their parent. This parent may also be experiencing age-related challenges, such as increased medical needs, loss of memory, and physical mobility. So again, we can think about if a person with intellectual and developmental disabilities is aging, we are assured that their parent, who is also the primary caregiver, is aging as well. When I was working as a resource coordinator in Montgomery County and Baltimore County, from time to time, we would receive calls from hospital social workers supporting an elderly patient at the hospital who just happened to be the primary caregiver for an older adult living with intellectual and developmental disabilities. These situations were very complex, as you can imagine. Often for the people we support, age-related issues are often attributed to behavior problems. And this has been experienced by many different service providers and family members. So for example, if a person with intellectual and developmental disabilities loses continence as they age, just meaning they have difficulty reaching the bathroom in time, it may be assumed that the person is not going to the bathroom because he or she does not want to go to the restroom or is upset with someone. So instead of thinking that this person may be experiencing an age-related issue of incontinence, it's automatically assumed it's a behavior issue. Staff can look at this as a person trying to avoid a task or going to a certain place. Sometimes the people we support as they age will experience joint pain, like in their knees. Again, this is something maybe some of us have even experienced for ourselves and stop walking. So again, instead of thinking about this as an age-related issue, it's automatically attributed to a behavior issue. Think about a woman who could possibly exhibit periods of sadness, then happiness, which is a change from their typical mannerism. We do not think this person may be experiencing menopause, but seek to control the behaviors the person has experienced with psychiatric medications. So, although service models are changing and shifting, a vast majority of adults living with intellectual and developmental disabilities are not encouraged to exercise, or it could be because of certain physical limitations, they cannot participate in different kinds of exercises. And of course, this lack of exercise and poor diet really increases the likelihood of those other chronic conditions, such as diabetes, high blood pressure, for example. And perhaps you as a family member may have experienced that your loved one was reinforced with food, sweets, and sodas again, used to reinforce positive behaviors. But again, that leads to lifelong patterns. Oftentimes, medical professionals, even though they may recommend certain age-related screenings, such as a colonoscopy or mammogram for their other patients, do not consider those age-related screenings for someone living with intellectual and developmental disabilities. And again, without these screenings, different conditions cannot be caught in the time that they need to be. I also worked with someone who did not receive her necessary mammogram screenings, and unfortunately, she was found to be with cancer, and it was too late to treat her. So again, that's a situation where, as the people we support age, we have to think about those age-related screenings that we would all participate in. And of course, we know that medical decisions as we age definitely increase in complexity, such as chemotherapy treatment or open heart surgery. This is again an example of a specific impact for people living with IDD. Can the person really understand this treatment? So we know that some people we support with intellectual and developmental disabilities do not have family involvement. There's a lot of different reasons that this might occur, but the unfortunate result is there's a total lack of family medical history, such as heart disease or diabetes, and this impacts on health preventative strategies, that lack of history. Some of us too, as family members and other advocates, might have observed this for ourselves, that there's high staff turnover in the different agencies and service providers. This really leads to a lack of continuity of care. So if the staff are changing on a regular basis, who remembers what, or where is that certain document? So of course this impacts a person living with intellectual and developmental disabilities in terms of their healthcare needs. Coordination of care is very difficult to maintain. And again, as healthcare needs increase, the person may go now to multiple doctors. Are the doctors talking to one another? Will the medications that were recommended interact poorly with one another? And again, as we noted before, the changes in staff really impact also coordination of care and poor documentation. So we know that there's been a lot of changes, especially in the last 10 or so years, in terms of how services are provided for adults living with intellectual and developmental disabilities. Some of these service models, although they're shifting and changing, still restrict choice. So let's take an example of a residential setting where the person might live with two other people. There are instances where only one staff member is assigned to support a residence with 3 individuals. What if one of those individuals wants to stop working and retire? There could be situations where there's no staff assigned during the daytime because the service models require that person to be out of the home in a day program or work situation. So how can that person stay home? They cannot stay home by themselves. So this is an example about how people living with intellectual and developmental disabilities are really impacted by the way services are structured and how they're delivered. And we know that funding patterns and different service delivery models are changing, but there still needs to be more work. So we just mentioned retirement. Is it for everyone? Yes, of course it is. This is a goal we probably all have. But of course, retirement and planning for the future involves saving money. This again is another specific challenge that people with intellectual and developmental disabilities face, especially in terms of saving for money. People who most often people with intellectual and developmental disabilities receive medical assistance or Medicaid, you might hear both of those terms, for their health care. And it is also how services from the Maryland Developmental Disabilities Administration are delivered to the people we support. So anyone who receives Medicaid or medical assistance cannot have more than $2,000 in assets. And that makes it very difficult, of course, to save for retirement. And we know it's a very high probability that persons living with IDD are unemployed or underemployed. And of course, this really limits anyway their ability to save for retirement. And also, since they are most often unemployed, they cannot participate in work-related programs that we might participate in, such as a 401k or 403b. So service models are changing and shifting, such as now there is the Maryland ABLE Act, which helps people with intellectual and developmental disabilities save for their retirement. So we know that there's changes happening, but there's still more work that needs to be done. We know too that some people with intellectual and developmental disabilities are now participating in activities at senior centers for their own social connections and learning new things and having fun. But again, there's a long road ahead of us on making sure that persons living with IDD who are aging are able to participate in all those age-related activities. Another specific impact of aging for persons living with IDD are considerations for end-of-life care. We may ourselves have experienced this as caregivers ourselves with an aging relative or loved one living with a terminal illness. These issues are just most recently emerging for people living with IDD. In the past, when a person with IDD had a terminal illness, hospice care was not even considered for them in the past. But we know now, again, those services are becoming more and more available to the people we support, such as Holy Cross Hospital has provided hospice care for many people that I personally worked with and helped them to die at home, just as probably some of us want to do as well. Unfortunately, we know that people living with IDD were thought to not have the capacity to play a role in medical decisions. In recent years, this line of thought has shifted, and specific tools were developed to help individuals with IDD and their family members and advocates plan ahead. You would see in the several tools that we'll mention later on in this webinar, the emphasis is for people with developmental disabilities to have choice and control over healthcare decisions and self-autonomy. We know even in our recent past, people with IDD were forced to undergo procedures and denied treatment. So we cannot ignore that history of how people with IDD were forced to undergo certain procedures. But as we mention these different tools and giving more and more autonomy to people with intellectual and developmental disabilities in terms of healthcare, we know that choices aren't done in isolation. We make choices every day, but even those smallest choices impacts the people around us. When we mention self-determination and self-autonomy in these medical decision tools, this gives people with developmental disabilities control over their lives, but it does not mean they do not make those decisions without a circle of support. You will see here over this circle here, and this is taken from the Community of Practice materials, and you can see from the graphic that there's many different aspects in a person's life. But of course, what is in the middle is the individual and a circle of support around them. So we know that people with intellectual and developmental disabilities have control over their lives and their medical decision making. But of course, they're doing that with assistance of people around them, including their caregivers. So why should we even think about planning for end-of-life care? There are many challenges that people with intellectual and developmental disabilities face in terms of end-of-life care planning. But we know our individuals and their abilities. Planning in this regard will be unique to each individual. Some individuals with intellectual and developmental disabilities can be involved in every step of the planning process, and some will need full support. The important thing is to not plan in the midst of a crisis. We want these tools to be in place so things just happen. We cannot think clearly during a crisis, such as an end-of-life care crisis. What are the few of the hesitations in planning for people with developmental disabilities? Sometimes there's a thought that if we talk about death with someone with IDD, it will upset them. But the people we support do experience losses, such as grandparents, parents, friends, and staff. They do understand and see those losses around them. I worked with a man who communicated mainly with gestures, and often these gestures were aggressive behaviors. And people thought he did not feel, he did not understand what was around him. But when one of the people that he worked with very closely died suddenly, he expressed himself through different gestures. It took some time to understand that he wanted to go to the funeral of his friend. We did take him, and he cried. No one had ever seen this person that we supported with very significant needs cry before. But we understood that this act of crying was for his friend. This person who died had some distant relatives still, but even those distant relatives did not care to come to the funeral. But someone with intellectual and developmental disabilities who cared for this person did show up to the funeral and really showed reverence and duty to bury his friend. People thought that he would not understand that, but they do want to participate in that memorial service. We should not underestimate their understanding of life and death. Oftentimes, there could be the belief that my loved one has no concept of this end-of-life care. But we can take those complex terms like pain management and make them more simple, such as, do you want to feel better? We can really take those different terms and kind of customize it to the understanding of our loved ones. Sometimes parents still have the belief that their other children will take over when they're gone. But there are cases where siblings just simply were not prepared to take care of their brother or sister when the parent passed away. I will never forget this one experience I had early in my career where a person living with Down syndrome still lived with his elderly mother, and he in fact had over 6 brothers and sisters. He did come from a large family, and when his mother died suddenly, all those siblings actually were in fact not prepared. The mother had never communicated with them or expressed that on how she wanted him to be cared for. And unfortunately, it really caused a crisis. And again, decisions were made in a crisis mode, not in a thoughtful and planning way, which was an unfortunate situation. So we have to take all of these different things into consideration as we're thinking about aging and again, planning for that end-of-life care. But before we mention these different tools that are available for the people we support in planning for the end-of-life care needs, let's remember that we are always advocating for the health care needs of our loved one. We know that advocacy is constant. Many people with disabilities use equipment and technology to live every day. For example, feeding tubes and ventilators are not extraordinary treatment for many people with disabilities and need to be viewed simply as a means of obtaining nutrition or breathing. And this specific quote is taken from People Planning Ahead, which we'll mention later on in the webinar as one planning tool you can use. Simply states that for some people we support, you might see that term extraordinary treatment, but for our loved one, that is just how they live. That's how they obtain nutrition. So we do need to remember that as we're advocating for our loved ones and their healthcare needs. So, what are some of these tools that can help people we support with end-of-life care planning and medical decision making? Because as we mentioned previously, as the people we support age, their healthcare needs are also becoming more and more complex. And again, these tools are conversation starters. They're certainly not everything you would need to do in terms of planning for this end-of-life care. Several of these documents are copyrighted though, so you will need to go directly to the organization to order these forms. These tools are not intended to be a legal document or replace legal guardianship. These tools are designed to be conversation starters, as I mentioned earlier. For example, you may be familiar with 5 Wishes yourselves. 5 Wishes is, again, one tool in the toolbox that you can utilize. And in fact, some service providers are using the 5 Wishes document to help with their planning tool. Now, later on, we will also recommend, in terms of our Catholic faith, to use those tools in tandem with a tool like the 5 Wishes. People planning ahead. Again, we will have this link available for you in one of our handouts. It was a tool specifically developed for people living with intellectual and developmental disabilities to think and guide families and caregivers in that decision-making process. My Wishes just happens to be a tool used for children, but it can be adapted as well for adults and the people we support. My Health, My Decision was a toolbox, I want to say. It's rather a series of tools that you can utilize, again, with your loved ones. So if you happen to know a service provider or other agency that you work with, I would highly recommend you go to this link, which will be in one of our handouts, and look through those tools, because again, it can help make sure that the people we support are involved with every part of the decision-making process to the best of their abilities. And of course, our own Catholic faith does have tools as well, which are available, Comfort and Consolation, Care of the Sick and Dying. So we can also assist you if you'd like to have more information about this tool. Please contact us and we can send you copies of those tools. I do want to mention, again, the use of a tool like 5 Wishes. I worked with a man who was in his late 60s, and he was a lifetime smoker. And the doctor diagnosed him with congestive heart failure. And it was not in his plan to quit smoking. That just was not going to happen. And his parents had passed away a while ago. So he's an example. Here's a man who's in his 60s. His parents have already passed, but he did have several sisters that were very involved in his life. So with assistance from myself and other staff, he did pick one sister to help him with his healthcare decisions. And before his health declined, and we do believe he understood to a pretty good extent that his condition would not improve, we went through the 5 Wishes very carefully as a team, each step, and he made the decisions that were best for him, and these were documented in that particular tool. Again, this agency happened to use the 5 Wishes tool. So after I moved away from the Baltimore area, I did see a colleague of mine, and I asked about him, and he did indeed pass away. But because that tool was used and planned, he had death at his home that was very peaceful, and he was surrounded by the people that loved him. Isn't that what we all want? But I would say if that planning wasn't done ahead of time, I'm not sure that he would have been able to die in the way that he wanted to die, with the people around him who he wanted to be around him. So what about our parishes? How can our parishes be sources of support for individuals with intellectual and developmental disabilities? Many parishes do have senior groups who may meet for lunch or other social activities. When these groups meet, consider inviting an expert in future planning. There may be some elderly parishioners that are caring for someone, could be someone with intellectual and developmental disabilities at home. It could also be a son or daughter with a very severe mental illness or other chronic illness. So we can use these existing senior groups or other outreach ministries like Stephen Ministry to give this information to our families and our seniors there at our own parishes. And in fact, a parish in Prince George's County, Holy Family Mitchellville, will be holding a session on special needs trust later on in this month in October. So again, if you're interested in attending that session to learn more on planning for individuals with intellectual and developmental disabilities, please contact us. We know that our churches are often places where people with intellectual and developmental disabilities grow up. We know that. We've known them from childhood as they've grown to adulthood and later on. So sometimes the people with intellectual disabilities from our parishes may be moved away to a residential, such as a group home. When you're preparing your different parish events, especially or different events around the holidays, please consider outreaching to these homes to bring these people truly in the margins, truly isolated, back into the life of the parish so that they can have a sense of continuity. Again, this is something our parishes can do to ensure that people can feel that love and support of the parish. And we sometimes have to remind ourselves that we are one church family. So don't forget to include seniors with intellectual and developmental disabilities in your own senior ministry, because they also experience very similar things to our other seniors, such as isolation and loneliness. So it does not need to be a separate program. We are one church family. So as we conclude this webinar, let's conclude with a few thoughts. As we saw earlier, people with intellectual and developmental disabilities are living longer than ever before. People with intellectual and developmental disabilities will experience specific impacts, as we saw earlier, related to their disabilities as they age, but they will also experience some similarities. Isolation and loss of social connections can occur as for people as they age, but as we saw earlier, people with intellectual and disabilities already experience that isolation and loss of social connection, especially as they leave school and move to adulthood. So again, this is part of how we can reach out to those people with intellectual and developmental disabilities who are aging. So our parishes, we can be that circle of people who are not paid to be in the lives of those with intellectual and developmental disabilities. So often when I worked in this field, when I asked people that I worked with, who are your friends, they would mention staff people. And yes, those people were good people and they care for them, but they were paid to be there. How would we feel ourselves if the only people around us were paid to be there? Of course, that would increase our own feeling of isolation and loneliness. But again, our parishes can be that circle who are surrounding that individual with intellectual and developmental disabilities to be true friends and true sources of support. We can do this topic more in depth at a future webinar, but a paid person, a residential provider, for example, cannot be involved with healthcare agents or surrogate decision makers because, again, they're paid to be in that person's life. We did touch on the topic of end-of-life care, and certainly we want to leave this webinar that is definitely not a one-time conversation for anyone, especially for people living with intellectual and developmental disabilities. It definitely will have to occur over many conversations. Our parishes, we are sources of support and continuity for people with IDD and their families. So again, think to your own parish. You may know some people who have grown up in your parish, and we are that source of support. That is a place where they have childhood memories and warm memories of their parents. So let us continue that and to be that continuity for people with intellectual and developmental disabilities. And yes, we here at the Department of Special Needs Ministries, we are here with the parishes to be a source of support and assistance, and also for our families and individuals. We are with you on the journey. And we also have some resources, not only for ministering, but also, we did not mention here earlier, but we have many resources as well for different spiritual and religious education, as well as other resources that are also community-based.
Rachel, thank you so very much for sharing with us all of these very imperative thoughts about how it is that we can, as parish families, support those that we love in our communities that are aging and living with intellectual and developmental disabilities. It's so important to think of our parishes as being the whole body of Christ, and knowing that when one person is missing, then the body is incomplete. So thank you for helping us to remember and consider those persons living with intellectual and developmental disabilities. We would like you to go ahead and use the question box that you see there on your screen to submit any questions that you might have regarding the material that Rachel shared with us this afternoon. We're happy to take any of your questions here through this webinar, through the question box that is available there for you to submit your questions. We're also very happy to help you at a later time if you think of something after our webinar has concluded. And if you have any questions, please feel free to call our office. The phone number here you can reach us is 301-853-4560. You're also, of course, very welcome to submit any questions through email, and the best email address would be specialneedsministry@adw.org. So we are happy to take your questions or your comments in any of those ways. We're going to leave that open for a little bit in case somebody is interested in submitting a question this afternoon. So feel free to put any questions you might have into the question box. We're also very excited to share with you that this is the first of a series that we will be promoting across this entire year. Our next Lunch and Learn will be happening on November 8th, again at lunchtime from 12 to 1. We're very, very excited to share that we are going to be celebrating the 40th anniversary of the USCCB's, our Bishops' Conference, pastoral statement on persons with disabilities. 40 years is a very important milestone in the existence of this resource, which for many people has been a very eye-opening 10-minute read that has really enabled them to see the church through a lens that they did not even realize was available to them, windows that are open to them. So we ask you to join us for that next webinar on November 8th. And additionally, if there are any suggestions for future webinars, we would be very, very interested in knowing topics that you might have that you would like to see us address this year in a Lunch and Learn series webinar. Additionally, all of the references that have been spoken about today and that Rachel was indicating are listed there in one of your handouts that are on the handout tab that you can see. There are 5 attachments. Here you see on this slide all of the references that you will find in one of those attachments with links to learn more about any of these particular resources. One of the resources that we talk about is the Guidebook for Aging and Down Syndrome. A PDF version of this document is available on the handout section of the webinar. This guide will discuss many of the issues that we've discussed here today and explore those in more detail. Although this is specifically relating to persons living with Down syndrome, many of the same principles can apply to other people living with IDD. This attachment is downloadable and there's no charge for you to download a copy for your own use. It is not permissible, however, for this resource to be sold in any fashion. And once again, our great thanks is to Rachel, and we want to thank her for her expertise in this field and all that she has brought to this ministry in her contacts and understanding of supporting persons living with intellectual and developmental disabilities. We're very blessed to have Rachel here on our staff, and we want you to know that we are with you on this journey. And we are happy to listen to your stories and maybe connect you in some resources, and together with a community of practice, support you in whatever role you are playing in the life of a person living with intellectual disabilities. Please contact us with your thoughts and ideas. We do appreciate greatly all that you are doing for our parishes across the Archdiocese of Washington, our communities, and of course, with one another.
So thank you again, Mary, with mentioning again about we are very interested in learning from you and how topics you may be interested in regarding our webinar series. So again, please contact us on the phone, also video phone number or email. And please note, we also have our Facebook here. And actually, to correct very quickly, our Twitter handle is at ADWDSN. So we apologize for that typo there for Twitter, but we encourage you to follow us in all of our social media outlets, and we really enjoy that engagement. So we will conclude our webinar today on aging impacts for people living with intellectual and developmental disabilities. And we look forward to seeing you at lunch again on November 8th. Thank you for joining us.